Hi, do you have knee pain? Pain that's preventing you from bending down to pick up and get things off the floor? Pain when you're trying to sleep, going upstairs, downstairs? You're not able to play on the ground with your kids or grandkids. You're not able to play pickleball, not able to golf. I'm Dr. Tammy Penhollow of Precision Regenerative Medicine, and I know what you're going through. So I've developed a knee boost system to get you out of pain, energize you, and increase your mobility. I've been doing pain medicine since I started anesthesia residency. That's been over 10 years. And I've treated tens of thousands of patients, specifically knee patients, over 3,000 in the last few years alone. I know what you're going through. That's why I developed the Knee Boost system to energize you and to mobilize you. Before we even sit down for a consultation, I'm going to draw some labs and make sure that we know where you're at from a metabolic standpoint and know if you're in an inflammatory situation. We will then heal you from the inside out with some supplements. We'll also be looking at anti-inflammatory eating. You will possibly get some films if you don't already have some recent films. For the knee specifically, we look at things like standing plane films, so we can actually see the amount of joint compression with you weighted. In very rare instances, we'll need to get an MRI, but that will determine at the actual consultation, which is with me. We'll sit down, we'll go over your knee films, we'll go over your labs, any operative reports, any other medical records you provided, plus your history. Take a good history and really know what activities you're missing out on, what you want to get back to, and how the knee pain is restricting you from doing that. We'll do a good physical examination, and I use an ultrasound for our exam. That way I can put your knee through range of motion with the ultrasound probe on the knee, and we can help diagnose some different things such as meniscal tears or strains or sprains of the collateral ligaments. Then we schedule you for your own procedure where we use your own cells, either platelet-rich plasma or bone marrow-derived stem cells, to help your body heal itself. We place those cells exactly where they need to go, also with the ultrasound, so that we can put those healing cells exactly where they need to be. Let your body work on that. To that end, you'll be placed in a brace so that we'll give your body time to repair before we go through some major activity. So there will be a little bit of activity restriction. You'll likely be meeting with a personal trainer or physical therapist to make sure that we get you back to your sport-specific activity. You'll also be taking some supplements to continue that healing from the inside out. And we're going to stabilize that joint. We're going to strengthen the muscles around that joint so that you're less likely to injure it again. You're more likely to be resilient and have the strength to go through all of those ranges of motion in those activities you love. We'll also use a very high quality CBD cream that's derived from the hemp plant, so there's no concern for THC. I find that it takes a little bit of time for your body's cells to kick in. So while you're waiting for that to happen and taking all of the supplements and doing the bracing and the gentle return to activity, you can use that cream. There'll be several touch points with me. That way we can make tiny tweaks along the way and make sure that we're actually achieving the goals that you've set at your initial consultation with me. So that is what's in the Knee Boost system. I'm Dr. Tammy Penhollow of Precision Regenerative Medicine. I look forward to helping you achieve your goals and getting back to those activities.